This day, we had the chance in this Choose Wisely Philippines conference. We talked about the role of neoadjuvant treatment in certain cancer types, especially in the curative setting. So we've identified over the years that there are certain patients who would benefit from neoadjuvant treatment prior to getting their definitive surgery. And I think it's important to send out this message, as we have learned over the past years that some tumor types, some stages, some tumor characteristics would have better outcomes if neoadjuvant treatment is given to them. And I think this Choose Wisely Philippines conference is very important, as we are able to send this message not only to doctors, not only to oncologists, but especially to patients. And we want this message to be brought up in clinic discussions with regards to the treatment options for these patients. Yeah. It's very interesting to see that these treatment options are available. We see that these treatment options for a certain group of patients would translate to better outcomes. We are able to identify high-risk patients. We are able to identify patients who might need more treatment. And I think that's something that's very important, especially in a setting wherein we now have better cancer treatments. We have seen good outcomes. And I think going back to the science, and translating it to each patient care, I think that is what is important. I think this is a very good conference. The Choose Wisely Philippines identified 10 practices that we might need to look into. I think as practicing oncologists, these are practical points. We've talked about some role of diagnostics, treatment options. And I think these are things that we might not be aware, and having these conferences talk about practical issues that will equate to better patient care. These are indeed very important.